Welcome, everyone. Thank you for joining us tonight for this online meeting / phone call about how to talk to your legislators for the Kentucky Home Birth Coalition. My name is Mary Catherine Deleter, and I'm one of the steering committee members. And I'm sort of going to be the moderator, if you will, for tonight. If you are dialing in from your phone, just a housekeeping note, if you would go ahead and put yourself on mute. And that way we keep any background noise down. And when we get to the end, we will have the time for question and answers. And if you have a question, you can unmute yourself to ask a question. If you are logged in on your computer, hopefully you see a slide right now that says welcome and housekeeping. It has a big mute sign on it. So you can type into the chat box at any time if you're having any trouble. And if you have questions at the end and you're logged on from your computer, you can use the chat box online to ask questions. And we're going to move right into our presentation, and it is being recorded so that if there's anything that you heard tonight that you want to go back and listen to again, you can. It will be posted on our website. And also, if there's anyone that you know who wanted to be here tonight and couldn't, they'll be available for them to listen to or watch online as well. So tonight our speaker is going to be Jack Hillard. He's one of our lobbyists from Limestone Group. And Jack, I went and got some of your information off of your website. So if you wonder how I know these things about you, I got it from your website. He's got 25 years of public affairs experience. He's represented several different groups in the past, and just brings tons of great experience along with his partner, Jason Baird, who are both working with us and for us and helping us in this whole process. So I won't take up too much more time. I'm going to go ahead and just turn things over to Jack and let him talk about some tips of how to talk to your legislators. So Jack, it's all yours.
Thank you, Mary Catherine. Let me say that Jason and I are very pleased to be working with the Home Birth Coalition and working on this legislation. I know that this effort really began in 2013 when legislation was filed in Kentucky, and Senator Tom Buford from Nicholasville was helpful in filing legislation during that year. And it was sent to a logical committee, Health and Welfare, and then it just did not make it out of committee. But Jason and I feel the progress and the work that you all have done during the last 3 years brings this closer to fruition this time. And plus work that your national groups have done, we think very much helps the effort. Mary Catherine, you can help me with this, but I believe it's certainly over 25, maybe 28 states have legislation similar to what we're trying to do with this legislation. But in Kentucky, Senate Bill 85 was filed last week, and the basic synopsis is, as you all know, I think I'm telling you what you do know, but I think it's worth covering. The synopsis and summary says an act relating to midwifery, making an appropriation thereof, which simply means because this creates a board, it does have to entail appropriation language, and I call some attention to that because it's a bit of a red flag that we think we can overcome, but it's still there. But it simply creates a new section of KRS Chapter 309, and it creates a board of midwifery, and it does provide for licensure and administrative regulation requirements to the practice of midwifery. And it establishes a trust and an agency fund to be administered by a board to implement the licensure of midwives. So that's basically the summary. Mary Catherine and Audrina have worked for upwards of 8 weeks or more very detailed with my partner, Jason Baird, and with the Legislative Research Commission staff to put the bill in the form that I think we're all in agreement now. It's what you all like. It's what you feel is comprehensive and covers what you believe needs to be done for this legislation to create the board and create certification and licensure. So we're comfortable with that. The bill was filed last week, and we believe tomorrow, I had a commitment from the Senate President's office on Friday that the bill would be sent to Health and Welfare again during legislative session tomorrow, which really is very good timing, and hopefully it does happen tomorrow because we have our legislative day at the Capitol with all of you on Wednesday, and you all have done a fabulous job of setting up multiple meetings. I think we have upwards of meetings of maybe a dozen legislators, and these are all senators at this point, where we're focusing upwards of 10 or 12 meetings with different legislators for Wednesday. So very, very helpful. And also at 10 a.m. on Wednesday, the Health and Welfare Committee meets. So this is all by design, but we think will be constructive, and we think it will be very helpful. So the first thing that I would say is for as many of you that can be there Wednesday, please do, and please make that happen, and please make every effort to bring a friend. I met with
Jack, if I could interrupt you really quickly. Yeah. For those who have joined us on the phone in the last few minutes, if you could just put yourself on mute until we do the question and answer session, that would be very helpful. Again, if you're dialed in from your phone, just mute yourself until we get to the point.
Well, thank you to whoever, whatever the feedback happening there. But in meeting with some of your group yesterday in Lexington, and we went over some of the same subject area, one of your group, who two of her children are teenagers now, and she gave birth to them at home. She's going to bring them on Wednesday. I would suggest any of that. Any of you who have children that way, it's very helpful. In talking to your legislators, it is simply very, very straightforward of talking as if you were at your local PTA or you were talking in any group that you are familiar with, your neighborhood association or really just a group of your neighbors. Your state representative, or in this case your state senator, is merely a reflection, being and I say a small r, a representative of a much larger group. And so to be in the meeting, just very straightforward, understand this is Senate Bill 85. I would suggest you read through it somewhat, but you're going to be the expert. And I think most of the legislators that you're going to visit with are going to be very welcoming to your message. I don't think you're going to get a lot of pushback, and I think they're going to be sympathetic to the cause. So don't be intimidated. Don't be anything except as if you were talking to a member of your family or a neighbor about this type of legislation. And I think maybe I'll say enough right there, and then maybe if, Mary Catherine, you want to do some Q&A here.
Sure. I'm just going to ask again that if you are dialed in from your phone to put yourself on mute. Unfortunately, I can't mute everyone who's dialed in from their phone without also muting our speaker, Jack, because he's dialed in from his phone as well. But we are getting a significant amount of feedback from someone. So please put yourself on mute if you're on the phone, unless you have a question. So if you have any questions so far for Jack, you can unmute yourself after I finished just telling you to mute yourself and ask the question, or if you are logged in online, you can also type a question into the chat box, and I will be glad to read that out loud. So are there any questions at this point? All right, well, I don't see any questions being typed in, and don't hear anybody asking questions. If you have yourself on mute and did want to ask a question, you can unmute yourself to ask that question. Or if not, Jack, I'll just let you continue on.
So there are multiple places that you could go online and Google, and if you just put in the phrase, how to speak with your legislator, multiple constituency groups like yours, whether it be a teachers association or somebody from any type of industry, in trying to, and it's all essentially what I'm really trying to stress is very elementary and very straightforward. And this is what we would say to any of our clients. First of all, and again, in what I covered yesterday with the three members of your group, they each knew who their legislator was. And so if you've already set an appointment in advance, then you obviously are ahead of the game. But if you have not set appointments or need any help with who your legislator might be, and again, right now we're just saying, who is your state senator? If you have any question, Mary Catherine or I, later in this call or tomorrow, we certainly could help you with this. And I guess one point right now would be my phone number, of which you're more than welcome to call me anytime as we're doing this whole process for hopefully the next several months to get this passed. But my phone number in Lexington is 859-489-9135. And I'm equally sure I'm speaking for my partner, Jason Baird. So researching your legislator to know, if possible, in talking to some of your friends or other neighbors, if you can establish some connection or know something about your legislator, that's very helpful. For example, one of the things that came up again yesterday, one of the members of your group does homeschooling. And it's my feeling that many of the legislators that we're going to be talking about this favor homeschooling. And it's all about, they are in favor of freedom of choice, more of what we would call philosophically a libertarian point of view. And we think that makes them very open to, philosophically, the efforts of home birthing. So if there's any, not every legislator might fit but a lot of it, Republican legislators, which of the 38 senators, well more than half fit into the category and the philosophy of what I'm talking about. And so, and it could be anything, not just a philosophical bent or a party bent, but trying to understand something about a legislator. So when you go in, maybe your children and theirs or their grandchildren attend the same school or the church, but being able to make some kind of a connection early on in the conversation is helpful. And then even if it's just the summary of Senate Bill 85, which I basically read to you early on, or even looking through the entire bill, just have some type of a short script that you can feel comfortable in talking to the legislator about. And then stay on that message. Don't back away from it. If you feel they are maybe not going to be supportive, or you just can't tell where they are, just stay on your message. We will provide you, I think Mary Catherine is working on a one-pager or a type of what we call talking points, and we will actually have copies of Senate Bill 85. You want to leave that behind with the legislator. And let me also say, for many of these meetings on Wednesday, we're going to be there with you. Jason and I will, frankly, we're committed to being all of them, except you all have created so many that we might not be able to be in two places or three places at the same time. One of the points would be understanding the system and some of the rules. I mean, basically, tomorrow, as I said, this will be on the Senate floor. It hopefully, and we believe we have a commitment from the Senate President, that this is going to be sent to Health and Welfare. Hopefully it gets a hearing in Health and Welfare, and then a positive vote, which moves it back to the Senate floor. But just being able to understand that you're asking a legislator, whether you see them Wednesday or you set up a meeting any other time in the next few weeks, that you're understanding this is in Health and Welfare, you'd like their support, if appropriate, and you'll learn early on in the conversation if they are really supportive. You want to ask them, would you be a co-sponsor of this bill? Obviously, of the members of Health and Welfare, if we had a majority of the senators who said, sure, I'd be happy to co-sponsor, that would nearly assure that we would get a positive vote out of Health and Welfare and send it to the entire Senate floor. Again, I'm going to back up, not in covering Wednesday, but this came up of just trying to set appointments with your legislator, whether it's for Wednesday or any other time during the session. Be persistent. The main number for the LRC or for your senators is 502-564-8100, 8100. Ask for your senator's office, and when you reach a staff member, tell them who you are, that you're calling about Senate Bill 85, and that you would like to, and hopefully you're asking, you would like to meet with the senator either in their office in Frankfort or when they are back in their district. During the session now, it's most beneficial to try to reach, if you're meeting a legislator back in the district, on a Monday morning or a very late Friday afternoon. And then, of course, if you can get them to meet over a weekend. So why don't I leave it at, in finishing that, in talking to them, in saying you'd like to meet, and if that is not what you're calling, that you're just calling to leave a message, then you very much would like the senator to call you back, to return the call, please. And then follow that up with an email to the senator. And because, again, this comes down to basic, you just call it sales of any type. A face-to-face meeting is number one best. At minimum, second best is a phone call directly with the senator. Third would be handwriting a note, and then fourth, maybe an email, and you all understand this process. So why don't I leave it at that and see if there are any other questions.
Thank you, Jack. I just wanted to add on to what Jack said about you can schedule a meeting to go anytime. We do have our lobby day on Wednesday when several of us will be there at the same time. But I know that there are some of you on this call that are not able to go on Wednesday, and I just want to reiterate that you can call and schedule and go to Frankfort anytime to meet with your senator. And if you are coming, especially if you're from further out in the state and are making the effort to come to Frankfort to see them, that really carries a lot of weight with them to know that you made the effort to come there to see them. Now, I know that it's not possible for everyone to go to Frankfort, but if you can, that's great. And we will do everything in our power to make sure that whenever you are available to come to meet with them, that we can have someone to go with you, whether it's myself coming to Frankfort to go with you, or if it's one of our lobbyists, Jack, who's been talking to us, or his partner, Jason. They're in Frankfort pretty much every day and could try to go with you. And so we will do everything we can not to send you alone if you're not comfortable going alone. And also, as far as meeting with them when they're back at home, we do have the Martin Luther King Jr. holiday coming up pretty soon, where the legislators will not be in session on that day since it's a government holiday. So that is an opportunity to meet with them on that day, since they will be not in Frankfort on that day as well. So we'll open it for questions if you have questions. I do have one question from Pam, who has typed it in the chat box, Jack, and she asked, is there anything not to say or anything that you should avoid saying or doing when you're with your legislator?
I would say the most important thing, Pam, and to everyone is to always do your very best to stay on point and do your very best. If a legislator just clearly doesn't understand or doesn't want to understand, or just for whatever reason, philosophical or otherwise, can tell just isn't going to agree with our point of view here, that you just leave it at that. That doesn't mean that if someone gives you the idea that, wow, we need to convince them, that to stay on point, stay with script, and tell them the story. And most importantly, share with them your own story and your own experiences. But I think what I'm really trying to say is it would help not at all to be confrontational if someone just says, well, we're not going to be with you, and so forget this, and I'm going to do what I can to make sure it gets voted down. Just you got to be able to say, well, thank you, I understand your point of view, and then this is it's not a zero-sum game. This is where we have to get the majority of the votes, and we're not going to get every vote. But it is important to try to talk to as many legislators as we can, even if we're not going to get 100% of the votes.
And that's a great question, Pam. And I will add that even if someone is not favorable when you talk to them, we want to have a report after every meeting that everyone has so we can gauge where that particular legislator stands. And on our website, under legislation, there's a link for an online form that's very easy to fill out. So if you go to Frankfort and meet with your senator, if you run into them at the grocery store and talk to them about this, if you go to a local event and run into them, wherever you see them and you are able to bring up the topic, we do want to hear about it and hear what they had to say so that we will have an idea of where each person stands. Also, if you get asked a question that you do not know the answer to, you can always say, just be honest and say, I don't know the answer to that, but I will have somebody else get with you. And that will either be Jack or Jason, one of the lobbyists, or myself or one of the members of the steering committee will get back to them and answer the question. But we definitely need you all to let us know what questions they had so that we can get back and answer those for them. And someone asked Jack, if it's assigned to health and welfare tomorrow, does that mean it's going to be on the docket for this Wednesday?
Yeah, and not likely. We can't say 100% for sure that it won't be on the docket for this Wednesday, but hopefully it gets assigned there tomorrow, but not likely that this quickly. Many bills go through a process of the legislature meets not just when they're in session like they are now, but it's called the interim sessions, which happen during the off months of the night, and many bills get heard during that time. Either fortunately or not, ours wasn't part of the interim session, so probably what they will hear Wednesday or vote on the docket Wednesday would be bills they've already heard about before. So not likely that ours would be on there Wednesday. But that doesn't mean it's not really good timing for Wednesday or any other time this week or soon, that if you talk to your legislator to be able to say, hey, this bill has been assigned to health and welfare or whatever committee, and let's hope it's health and welfare. But if it goes to licensing and occupation, but to be able to say to your legislator quickly, you know where it is, and really appreciate their support in that committee.
And I'll also add, now that we have our bill number, SB 85, be sure that you know that, commit it to memory, and use that every time you are speaking with a legislator. Even if you're speaking with not a senator but a representative, you still want to use that SB 85. If we pass out of the Senate, then our bill will go to the House, and it will still be SB 85 because it's in the Senate. So they have so many bills that they are looking at and considering that if you just say, the bill about midwives, they may not have any clue what that is, even though ours is the only bill about midwives, I'm pretty sure. But you want to use that number, SB 85, anytime you have any correspondence with your legislator.
And also use the phrase, though, or the term SB 85, it's a bill on midwifery, or SB 85 midwives, or SB 85, it's what the Home Birth Coalition is working with. Any of that phrase, but use some together, and they will immediately get the connection.
All right. Well, if anyone else online has a question, feel free to type that into the chat box. Or if you are dialed in from your phone and you're not logged in on your computer, feel free to take yourself off of mute and ask your question out loud. And here's another question online. The person who's asking this question is Joe, and Joe is a midwife who actually lives in Virginia, but she serves clients in all of Eastern Kentucky. And she asks, is it actually helpful for her to be coming from Virginia since she doesn't actually live in Kentucky, but she serves people in all of Eastern Kentucky? So, Jack, what would you say about that?
I would say it's still helpful because she is helping Kentucky women, and she has experience in what we're talking about in this legislation. Maybe not, depends on maybe how many births she helps with, but I would say yes, it would be helpful.
And Joe, I was at a legislative advocacy workshop today, and this topic was sort of brought up that even if you are not a constituent of a particular legislator, you can still say, but I have clients who are your constituents, and obviously you are influential with those people who are voters of that legislator. So that's definitely, I think, and the fact that you are one of the few midwives serving that entire region also is an important point, too. We want to increase the midwives that are available to help you out.
And I would think...
Go ahead, Jack.
Well, I was just going to say, and this is very logical, I would say, Joe, but being able to identify the counties, the cities, and that way we can help you, legislators, that it might be the most effective for you to talk to. But where you're helping with some of these clients in these births, if it happens to be Prestonsburg, Floyd County, then we'll know which legislator to hook you up with, or if it's Pikeville or Hazard or Harlan.
Yeah, and she kind of just asked a question that that alluded to that. Who should she specifically be talking to? And that's kind of what you just answered already, is that we will be able to look at which of those Eastern Kentucky senators we have meetings set with that fall in Joe's service area. And if she's able to be there for some of those meetings, then obviously those are the ones we would want her to go to. And Joe, I know we've updated the list online today of all the meetings that are scheduled, and there's quite a few of them all over the place, so you can take a look at that. And it has, on the Facebook event, it has the counties listed for each one, so you can see who we have at what times scheduled for meetings, and see what's going to maybe correspond with your schedule. So are there any additional questions, either from anyone who's called in on the phone or who is online?
Mary Catherine, can you hear me?
Yes.
Okay, this is Elizabeth. Sorry, I was late joining the call, so if I ask a question that's been covered, I apologize. But I have one question that stems from the question from Joe. Would it be beneficial, because I have a meeting scheduled with Thayer, my senator, at 9:30, right? And then would it then be beneficial for me to attend some of the meetings in the counties that I serve? Because I do go to Eastern Kentucky some as well. So if that would be helpful, because I know we've got some important people in Eastern Kentucky. So I can do that. I'm going to be around as much as possible on Wednesday. So,
Elizabeth, I would just say I think it would be extremely helpful.
Okay.
I mean, and for exactly the same reasons we were talking about, Joe, that for you to be able to talk to Senator Stivers, or how that, where you have clients, but being able to know in advance so you can specifically be able to say, you know, Senator Stivers, I have clients in Clay County, I've done clients in your hometown of Manchester, and I mean, that just makes that connection.
Yeah, okay, I can try to do that. And then my next question is, you had said something, and I don't know if this is really even that relevant, but you had said something about not being confrontational if they say, I mean, how likely is it that they're going to not be receptive, or rather, are they likely to do things like just agree with you for argument's sake or whatever, and not be truthful, if that makes sense? Do you know what I mean?
I think I'm trying to follow you, but I think most of them are going to be just straightforward. I don't think they're going to try to, at least it's my...
They're not going to be like, and when you get out the door, they're not really,
Yeah.
Okay, cool.
At least in broad perspective, that's not my history with legislators at all.
Okay, good. I didn't know.
I mean, they are politicians, so yeah. I mean, I know where you're coming from, but I don't generally find that. Now, that doesn't mean that, and let's just cut right to the one of the things that my partner Jason Baird has been working with Mary Catherine and Audrina very, very closely, and this is a critical part of what we're trying to do is, and we would do this on no matter what the issue is, but building a coalition of groups. And so we've been trying to work with the hospital associations, the medical associations, the nurses, and we're getting, I would say, Mary Catherine, you add to this, but Jason and I are feeling really pretty good that the work you all have done, this is, we're going to have a coalition that the legislators are just very, they're favorable. Now, legislation that Jason and I worked on last session. I mean, you can think that one of your coalition groups is, and this involved an insurance company, insurance group, and this involves something. I work very closely in cancer prevention, and that's mostly the kind of legislation that I work on is related to cancer and cancer prevention. And the insurance group said they were with us all along, and we ultimately got it passed. But they were talking out of both sides of their mouth, and we had some misleading things but that doesn't usually happen. But I don't want to say it can't happen.
Right. Elizabeth,
I know not only.
Catherine again.
Go ahead.
I was going to add. I spoke. I went to an event this past weekend and spoke to Senator Higdon and told him about our bill, and he was not negative, but he had some questions at the very outset. He said, I support what you're doing. It's a great cause, but he was concerned about costs, as legislators often are.
Right.
Creating a board of midwifery, what will that cost, and are there ways to do it that's less expensive to maybe be under another board, and so on and so forth. So while they may not be rude or negative per se, they may have questions that challenge, and we are working on answers to be able to have, if similar questions to that come up, we'll be able to address those on Wednesday, hopefully in an acceptable fashion.
I suspect that money question is going to come up quite a bit. So I was wondering if y'all had an answer for that yet.
Well, again, I would go back to Mary Catherine's earlier point that where we don't have a specific answer yet, we just say, Senator, we just don't know yet, but we are working on that. But and this is not necessarily a talking point to them, but for your background and to know, I mean, this is where divergent things begin to happen. We think that Governor Bevin ultimately, and maybe soon we will know, would support Senate Bill 85. And yet at the same time, we think, we know at the same time, coming out of the governor's office and the Senate president's office, that there's to be no new spending. I mean, we're talking, because you all read the headlines and understand things of pension problems and others. I mean, the Senate president's office, in the Senate retreat a couple of weeks ago, where they spent 3 days going over legislation, the basic word coming out of their pre-session conference was, there's going to be no new spending, just period, nothing new. Well, the fact is, yes, creating a board and licensing does, but it's very, very, very small. And so with the governor's support and such support that we think we have in the Senate already, it can get done. Or at least that's our opinion at the moment.
Good. Okay. That's helpful.
All right. Do we have any additional questions? Again, if you are dialed in on the computer, you can type your question in the chat box, or if you are called in on your phone, you can take yourself off of mute and ask a question at this time. I'll just take this moment to reiterate a couple things. Whenever you are contacting a legislator's office, if you live in that person's district, first and foremost, identify yourself as a constituent, and you will get further, hopefully, by letting them know that you are a constituent of that district, because that is who they're going to pay attention to first, is the people who vote for them. And it doesn't matter if you did or did not vote for them, but the fact that you live in their district is important, and you are their constituent. And then also, if you are coming on Wednesday, we will have some note cards there that we can write handwritten thank you notes to thank them for meeting with us, that we'll be able to deliver after the meetings. But if you meet with a legislator at another time, not when you're with us on Wednesday, a handwritten thank you note is always a great thing to do as a follow-up as well. and it can include a picture of your baby who was born at home, a birth announcement. And we do have our postcards that we are going to be sending to all the legislators. If you have not filled out a postcard, if you have had a baby at home in the past 3 years in Kentucky, we invite you to go on our website and fill out our form, and then we will have one of our volunteers, Christina, who's actually is or was on the call a little earlier. She is filling out postcards to let them know that a new little voter was born in your district, and it kind of has some information about the baby and about you. And what we're going to do is take all the postcards that we have for the Senate Health and Welfare Committee members, and as soon as we know that it's going to be heard in that committee, those postcards will be delivered to those senators just a couple of days before our bill is heard in the committee. Then if our bill advances to the floor of the Senate, the rest of those postcards will be delivered to all the senators. So little things like that to let them know that people are paying attention to this issue and care about it will go a long way. So postcards, handwritten thank you notes, those are all great things. So again, if anybody has any questions, just type those in the chat box, or you can take yourself off of mute and ask those right now. Well, I'm going to go ahead and mention a couple of events that are coming up. Obviously, we have talked several times already about the fact that we have our lobbying day in Frankfort coming up on Wednesday, this coming Wednesday, and anyone and everyone is invited to join. You do not have to be a home birth client to attend. Anyone can attend. And we had one mother who said, I had both of my babies by C-section, but I totally support what you're doing, and I'm going to try to come. And that's awesome, because if you support birth choices and the right for families who choose a home birth to have a licensed qualified attendant, then you can certainly talk about this bill. I'm going to tell my grandmother that she can talk to her senator, because obviously she cares about this too, because her grandbabies are being born at home. So it doesn't matter who it is, if anyone supports this in any way. And we want legislators to see that this is an issue that has broad support from people of all walks of life and all types of people. So it doesn't matter who you are, you can certainly come and participate in this. And we're going to have a room reserved. I believe it's room 113 from 8:30 a.m. to 1 p.m. in the Capitol Annex building. There is information on our website with a link to parking information and how to get into the Capitol Annex. That room is going to sort of serve as our home base, assuming that we don't get bumped out of the room for any reason. It's always possible that a legislator decides to call a surprise meeting and we won't get the use of the room. We'll make do if that happens, but hopefully that won't happen. So we'll kind of have our room as our home base that you can come back to between meetings. We have posted the schedule of meetings for all the senators that we have folks scheduled for so far. And the way we have gotten those meetings is that individuals who are going to be going on Wednesday have personally called the office of their senator to schedule that meeting as a constituent of that person's district. So if you're planning to attend on Wednesday and you have not yet called to schedule a meeting with your senator, please call first thing in the morning and say, hi, I'm a constituent of Senator so-and-so, and I'm going to be in Frankfort tomorrow. Excuse me. I'll be in Frankfort tomorrow during these times, and I want to know if the senator has some time that he or she could meet with me. And it's to talk about SB 85, the midwives bill. And more often than not, they'll say sure, and they'll give you a time. And then you can let us know about when you have that meeting scheduled so that we can plan to have either one of the members of our lobbyist team or one of the members of our steering committee go with you so that you're not going into that by yourself. And so that's basically the process. Then you can come. We have said that if you have children that you would like to bring with you, if you have a baby who is able to be worn in a sling or a carrier, that would be fine. If you have older kids, school-age children who might be interested in learning about how this whole process happens, it'd be great for them to come too. probably won't be the most engaging thing for toddlers or preschoolers unless they are just really into sitting through meetings with legislators. But babies or older kids probably would be perfectly fine to come. I know there's a few homeschool families who have said this is a great opportunity for a lesson, and they are bringing their kids for that purpose. At 10 a.m., we're going to try to go, as many of us as we can, to the Health and Welfare Committee meeting. And as the senators who are members of that committee come in, just try to, introduce ourselves and say, hey, and, this is who we are and we're here, and just sort of say hello to them as they come into the meeting. And then sit through that meeting just to let ourselves be present and be seen as supporters of this bill, even though our bill, more likely than not, is not going to be heard that fast this Wednesday. So we have that lobbying day coming up. And then also some events are happening. If you live in the Louisville area, the Louisville Free Public Library is having a series of events every Saturday at different branches of the library, where different legislators from different districts are going to be at different library branches. Basically, it's a meet and greet event. It's solely for the purpose that you, as a constituent, can go and talk to your legislator somewhere that is convenient for you. And we've posted several of those as events on our Facebook page. You can also go to the library's webpage and look those up. The events are called Cafe Louie. They're every Saturday morning from 9 to 10 a.m. I went to the one this past Saturday morning at the Fern Creek Library branch and where I spoke to Senator Higdon. And the format of those is there's just sort of a mingling time, and the Friends of the Library volunteers who organize the event take questions written on note cards to ask, and then they have sort of a Q&A, formal Q&A session towards the end. So there's a kind of just a mingling meet and greet, and then sort of a structured Q&A portion of those events as well. So check to see if your senator is going to be at any of those events coming up, and that makes a nice, convenient way for you to go and meet with them and not have to schedule anything. You just show up. And as we said before, you can also call and schedule a meeting with your senator, not just this Wednesday, but whenever you can go. They are there in Frankfort Tuesday, Wednesday, Thursday generally are the best times to catch them. So if you can go on any Tuesday, Wednesday, or Thursday, go ahead and plan that and let us know. And we will, like I said earlier, either one of our members of the steering committee will plan to meet you there, or we'll try to work it out so that one of our members of our lobbyist team can meet you and go with you if you'd be more comfortable to have someone to go with you. And then you can also always, again, try to meet with them when they're at home, either on a Monday morning or a Friday evening once they get back into their home district, or over the weekend if they're willing to do that. Or we also have a holiday like Martin Luther King Jr. Day coming up pretty soon that they will not be in session on that day. So those are opportunities that you have. I've been talking for a few minutes, so if anyone has thought of an additional question, feel free to type that in, or you can ask it out loud also. So I'll just pause there for a moment in case there are any additional questions. All right. Well, feel free to Yes.
Sorry. This is Gladys. I finally got the nerve to ask a question.
Go right ahead, Gladys.
So I took a look online real quick over the meetings that are already scheduled. So while people are not in those meetings, would they be meeting together on that room that is already reserved? Is that how things might play out?
You can go back to that room and sort of hang out there if you want to. You can also tag along to some of the meetings, even if it's not your senator. Or you can also try to just go and randomly go to an office of a senator and say, hi, I'm so-and-so, and I live near, and if you're not in that person's district, but if you live near that person's district, you can try to go talk to them. And our lobbyist team, Jack and Jason, may have input on who would be strategic people to try and go drop in and see if you can. Jack, I don't know if you have anything to add about how we might be strategizing that on Wednesday when folks are not in their set meeting with their particular senator, how they might go about choosing who to drop in and see if they can.
No, I think it's exactly as you just answered it. If there's not already a meeting that was set prior to Wednesday, or maybe you already have an appointment and a meeting set, but you realize with our help or somehow you realize there's another legislator that you might be able to see, then that's what I would suggest on some of the downtime. But frankly, I don't think there's going to be a lot of downtime. Let me just fill in just very briefly some here, and this is just very basic. We're, I think, assuming a little bit that on one of a school trip or somehow of your Kentucky history, maybe you've been to Frankfort before, but on the Capitol grounds, there are really only two buildings. I mean, if you include the governor's mansion, maybe three, but there is the Capitol, and directly behind the Capitol is what's called the Legislative Annex, and that's where all the meetings we're talking about are going to happen. And so when you drive behind the Capitol, there is ground parking, but health and welfare and Wednesdays are typically very busy. So two things. One, if you don't find parking on that top level, on that ground, there is below ground parking, the parking structure that goes down 6 floors. So my recommendation would be try to find something on top. If not, feel very comfortable in parking in the garage, and then you take the elevator back up to that, and you enter in the doors that are directly behind the Capitol. And then you'll go through some very brief security. You'll sign in, and what Mary Catherine is saying, room 113 is straight down that hall. You wouldn't be able to miss room 113. But, and this is important, because health and welfare begins at 10 a.m., that room will begin to fill up around 9:30 or shortly after, and certainly by 9:45. So it would be important if we have a dozen of you or 20 that show up on Wednesday to try to be there as close at least by 9:30. And we already have some meetings scheduled before 9:30, so many of us will have already been to some meetings. But if you don't already, try to be there at least by 9:30 so you can go to health and welfare. And even though our bill will not be heard probably, you probably will have the chance to be introduced. And so if we have a large segment, then that will be really, that will make a very, very favorable impression if we have a number of people that are representing the group.
I have a question about that. This is Elizabeth.
Sure.
Mary Catherine, my scheduled meeting is at 9:30. I would like to come to that committee meeting if I'm out in time. And you had mentioned that it probably won't be more than 15 minutes or so, actually face-to-face time with Senator Sayers. So,
yes.
Will I have?
I know that
somewhere. Did somebody save me a seat? Or
Yeah.
I know that the meeting that I scheduled with my senator, they specifically said you'll have 15 minutes. So I think that you'll probably have plenty of time. And even if you did run over past 10 o'clock, it's my understanding that you can still come in and go out at any time. Is that correct, Jack?
Oh, yeah. You and if for whatever reason you get caught in traffic or anybody, if it's 10:30, don't feel like you can't come to, and this will probably be in room 169. That's where it was this past week. And I guess that was the House, but the Senate Health and Welfare usually same room. It's a pretty large room, but I'm just saying people do come and go. We'll do our best to save some seats, but try to come even if it's, and Elizabeth, you should have no problem in getting from Thayer back down to the committee.
Okay, great. Thank you.
I was just going to say, we do have all this information on our website. There's a link for the parking information, and there's pretty detailed information of what Jack just summarized of how to get into the annex. I was just there today for a workshop. It's very, very simple. Everyone's very helpful if you need to ask a question as far as how to get to where you need to be. The security guards at the front are very friendly and very helpful to tell you right exactly how to get to the room that you need to be in. And just don't be nervous, basically. We want to have as many people there as we can to make an impact. So if you have any questions in the future but you didn't think of tonight, you can always contact us via email, info@KentuckyHomebirthCoalition.com, whole thing spelled out. You can contact us through any of our social media outlets on Instagram, Twitter, or Facebook. And make sure you're following us on all those outlets. And also be sure that you're on our mailing list as we send out updates as things are progressing through this process. And you can also sign up for the mailing list if you're not on there on our website. All the information should be on our website. We also have information that it kind of explains the bill a bit on the website, including links that you can read the entire bill in advance. Some of it may feel like it's kind of over your head legal, legislative speak, but most of it's really easily understandable, and it's not going to be beyond anybody to comprehend what the bill's about. But any questions, literally all, there are no dumb questions. I can say when I first got involved with this group in 2012, I did not know any of this. I did not know how you get a bill, how you find a sponsor, how you make this thing work, and I have learned so much about the process just by asking questions and showing up and being involved. So don't worry that you don't know exactly how everything works. We're all in this together to learn and to make a difference. So I'll pause right there again to see if anybody has thought of any final questions. All right, well, thank you, everyone, for taking time to be on the call with us tonight. I know we had several people who dialed in, and I see that we have quite a few people who are logged on to the computer. So I hope this was helpful. And, again, please contact us with any questions you think of in the future. And thank you for your time, and hopefully we will make lots of progress in the coming weeks. And thank you, Jack, for taking time to be here with us and answer questions this evening as well. We appreciate that very much.
Well, happy to do it, and feel free, any of you, to call me anytime, and we'll do our best to help.
Okay. Well, thanks, everyone. That concludes our meeting, and I hope to see many of you on Wednesday, and if not Wednesday, sometime in the near future as we work on this project together. Thanks, everybody. Good night.